It is time to reimagine leadership. My name is Ben Owden, and I would like to welcome you to a series of conversations in partnership with WomenLift Health around how can we develop new approaches to the new challenges that leaders face in the 21st century. Greetings to you. I hope you are doing well and are having a meaningful and productive day. Welcome to another episode of the Why Lead podcast, and I'm your host, Ben Owden. We're having a series of conversation in partnership with WomenLift Health, and the idea is to reimagine leadership, and particularly to look at new approaches to new challenges that are emerging in leadership, and particularly in the space of healthcare. And so in this conversation today that we're having, we'll be having a conversation exploring how partnerships between organizations, governments, and stakeholders are essential for advancing women's leadership in various sectors, including healthcare. And so to have this conversation, I am joined by a well-respected leader known around the world for a career spanning 17 years within the International Federation of Red Cross and Red Cross Christian Societies, and before that, as a medical director in the field. He stands as a consummate humanitarian diplomat, adept in the craft of forging strategic alliances and managing intricate relationship across partnerships. He is the Chief Executive Officer of RBM Partnership to End Malaria, the largest global platform for coordinated action towards a world free from malaria. Ladies and gentlemen, Dr. Michael Charles.
Thank you very much, Ben, for the introduction.
Now, you've had success in your career and you've navigated the complexities of international diplomacy to cultivate successful partnerships with a broad range of stakeholders, including national institutions and governments. How did you manage from moving from a more theoretical allyship to a more actionable partnership at all levels of your engagements? How did you make sure that you see true change and true partnership?
Great. Thank you very much, and great question. For me, I've always come from the school of thought that you can't do it alone. We need to collaborate. We need to reach across board. And that's something that I really pride myself in terms of really looking for those other partnerships that we can forge to ensure that we get to the finish line. Obviously, if we look at health, or if we look at malaria specifically, it's obvious from the countries that have been able to eliminate malaria that they haven't done it from a health perspective alone. There's education that is involved, there's infrastructure, there's agriculture, there are all sorts of things. So partnership for me and for any leader should really be an integral part of what we do. There's a famous saying, and I'm sure you have it in Swahili as well, that says, if you want to walk fast, walk alone. If you want to walk far, walk together. And that's for me what partnership is. If we're meant to break the social norms, if we're meant to really achieve purpose, if we're meant to strengthen our communities, bring more women into leadership, we need to do that in connection with partnerships and really spread our tentacles. And that's why the RBM Partnership to End Malaria is a partnership of over 500 partners working together. For me, more partners need to join, because I think that's really how we're going to really eliminate malaria from this globe.
I like what you said there, and I think I sense this systemic thinking around the approach that you have taken and the approach maybe your organization is taking as well. And so how do leaders begin to develop that sense of systemic lens where you're not just looking at a partnership from a surface level, but actually looking at it from all possible angles? And I think when we talk about advancing women leadership, sometimes when you purely look at it from the career perspective, you're not having the type of impact that you want, right? When you're looking at it from a personal perspective, there's so many angles to it. So that sense of holistic, systemic lens, how do leaders develop that? How has it been developed in you? Because clearly from the answer that you just gave, I can sense that that's how you look at the world.
For me, in leadership, you need to have a sense of purpose, and every leader needs to define that. What is their sense of purpose? For me, my sense of purpose is to make a difference and to make a mark, and to ensure that I leave something behind for the next generation. That's why I believe in gender equality, and I believe in bringing the youth to the forefront. With a continent that has a huge youth bulge, with a continent that has a lot of unemployment, I always see it as somebody gave me a chance. And I need to give others that chance as well. And that's why bringing the youth into the forefront is really important. Now in my organization, we're trying to work on an internship program as an example, trying again to bring the youth, train them, mold them, and then you really take them into leadership. So I think that's number one in terms of what has inspired me. Second thing is, I have 3 kids, 3 boys, and every day when I wake up, I try to instill into them as well in terms of, what leadership is, what they need to do, how they need to cultivate it, and really how they need to make sure that we live it better than we found it. And that's what wakes me up in the morning to say, how do I live it better? How do I do things differently? The third thing is around, innovation. As leaders, we need to break the norm. We need to question the norm. When people say it cannot be done, why can't it be done? And I always like, the famous quote of Nelson Mandela: "It almost seems impossible until it's done." When I started off my career, and in my last post, because of the things that I wanted to achieve, a lot of people laughed and said, "No, it cannot be done. Why would you bring women into leadership? Why would you, have so many young people?" And I'm happy to say that some of those young people today are senior leaders. Well, not senior leaders, but they're leaders in their own field. So really being intentional about what we do, I think is important, and really being innovative as well in terms of really just trying to break the norms. I used an example earlier today that, we say behind every successful man is a woman. Why does it have to be behind? Why can't it be beside or in front of every successful man is a woman? And I use my wife as an example to say she's the rock, she's the pillar. And I'm not ashamed to say that because that's the truth. Without her, I wouldn't be here. So really just trying to embrace that new way of thinking, that new way of leadership, and really making sure that we do not leave the younger ones behind when we're thinking. We need to make a conscious effort to mold them in a way whereby we can continue to build new leadership as we forge ahead. So leadership partnership, I think it's something that I'm very passionate about, and I'll continue to be passionate about it in terms of really bringing that together and embracing gender equality, gender equity, and making sure that we can bring our women to leadership as well.
Wow, what a potent answer. Now, one of the strategies for strong partnerships is when you are able to successfully make your ideas everyone else's ideas, right? And I think when you're able to transfer that sense of belief in an idea to other people, you have very strong buy-in. Now, what are some of the things we can do collectively, I guess, as a world in that sense, to make this idea, and this statement really stood out to me when I first saw it, when women lead, better health follows. And the more I thought about it, I'm like, actually, yeah, well, whenever I interact with women who work in the healthcare space, the sense of care and buy-in and commitment is different. And so how do we get to a point where there's a critical mass of people, everyone, including men, I think maybe especially men, to believe in this idea, to buy into this idea that when women lead, better healthcare follows?
Yeah, very, very good points. Half the population are women, and the other half have been born by women. So we need to respect women. And there's also a saying that says, if you educate a man, you educate an individual. If you educate a woman, you educate a community, you educate a nation, you educate the world. So I think, experience has taught us that, if we really want to succeed, we need to bring more women to the fold, because women, and that's how God have created them, they're more emotionally intelligent than men. And I hope I can say that freely, from my experience anyway, more emotionally intelligent. So how do we use that, bring that to the fore in terms of really making sure that we can make a difference? You've said it as well, if we look at healthcare, 70% of community health workers are women, because women are passionate. They're sincerely passionate about what they do. They're home, they take care of the home, they take care of the family. So really embracing that is what we should be doing. Now, how do we bring that male allyship? How do we get more people to follow suit? By living by example, showing others. And that's why I said, we need to be intentional about it. Showing others that it can be done, bringing others closer to us, making sure that we start grooming the men, the boys from now, to ensure that they don't see patriarchal way of thinking, that they see more as, okay, let's look at the individual, let's look at the competency, and whether it's male or female, let's just really look at, the ingredients that is within that human being. The third thing is, how do we create a space of always looking at the best in individuals? A lot of leaders nowadays, they look at people's weaknesses. And I always tell people, we all have strengths and we have weaknesses. How do we use the people's strengths to be able to address their weaknesses? So really making sure that we're intentional in terms of, empowering, motivating, mentoring, molding, and ensuring that, again, we can continue to create a good breed of people that can graduate into leadership.
Thank you for that. And as we're winding down our conversation, there's a statement that says people, sometimes when we think about change, people there's a general sentiment that people don't like change. But this particular quote says, it's not that people don't like change, people don't like loss. When you're asking someone to change, there's a sense of loss to an idea, to a way of thinking, to an ideology, to whatever maybe sometimes benefits that they were getting from a particular system. And I think when we talk about advancing women leadership from a male perspective, there's a sense of loss to an ideology, parting ways with something that maybe we have been taught to believe for a very long time. And so that creates a sense of tension. Now there's tension around when you talk about advancing women leadership. It can be a topic that divides people rather than uniting people. And so when we think about allyship, when we think about partnerships, tension is always there in the room, in those conversations. Tension is always there around the conversation. So how do we overcome that tension in the pursuit of really being aligned? I like what you said there, right? If you want to go far, go alone. But if you want to go fast, go alone. But then if you want to go further, you have to go together. And I think when you talk about allyship and partnership, advancing women leadership in healthcare, it's something that we have to do together and we have to go together. And in doing that, we have to be in a space where the tensions are addressed and the tensions don't divide us, rather they unite us. And so in your own experience, how have you been able to deal with that tension and use it to move you and your organization and whatever you are advocating for forward?
The tensions will always be there because we all come from different schools of thought. So that tension at the moment is not going to go away. But the way I address it are twofold. Number one, how do I communicate the opportunities of that change? What are the benefits to society? We can ask anybody here, and I can again speak of my personal experience with my 3 boys. Anytime they're hurting, anytime they're in pain, who do they go to? They go to their mother because they find comfort, they find a safe space, and they know that definitely something will be done. If they come to me, it's a different story. So again, how do we, start molding from a young age? And that's why for me, I really focus on the youth, because we can continue to shape them and mold them in a way whereby, they see the opportunities that lie ahead. Opportunities that lie ahead in female leadership, in male allyship, and in terms of getting our society right. And, there was said also this morning in terms of some of the conversations around even some of our policies that are out there, some of the land laws, some of the reforms that need to be held, whereby it, takes power away from the women. Again, how do we look at opportunities within that to again be able to, just tackle that and see how we can work together and better together. So I think for me, it is communicating those opportunities in a manner that makes sense, and really starting from a young age in terms of just trying to break the barriers, remold the cultures, because, some of us that are over 50, 60, changing them and changing their ideas is almost impossible or hard. So let's continue to educate the younger ones to be able to do that. And hopefully the next generation will be better than our generation.
Wow. Thank you so much for your time, Dr. Michael. And actually, maybe I give you a compliment. When I walked in your session, you said if you're invited to a panel and it's just men, you say no. And I was like, that's quite a thing to say. And then you walk in and I think the majority of your team are women. So I was like, okay, so he has integrity, if I was to judge it by this. So thank you so much for your time and for your thoughtful responses and for inspiring us and giving us something to think about and reflect on. And to our dear listener and viewer, this has been the WireLead Podcast. I'm your host, Ben Owden. Thank you.
Thank you very much.
Yeah.